Assalamualaikum. Today we are going to look at cranial nerve examinations. So, cranial nerve examinations, as you know, there are like 12 cranial nerves. So, we'll see at each of them one by one. So, the first cranial nerve is your olfactory nerve, as you all know. So the olfactory nerve is basically how do you examine the olfactory nerve if it's working perfectly. So this is a simple test that you do in an outpatient department itself. So when the patient comes, you have to ask the patient to sniff, that is to smell various non-irritating substances. That is, you can give coffee, you can have coffee powder in a bowl, or you can have anything that is non-irritating, fragrance which is non-irritating. Some common fragrance you can have some kind of essential oil like eucalyptus oil, which is very common. So you have to tell the patient to smell, and then if the patient correctly tells it is coffee in this cup and there is some oil, eucalyptus oil in this cup, so when the patient tells it right, then it means the olfactory nerve is functioning properly. So that is cranial nerve 2, which is the optic nerve. So as you know, in optic nerve, the first thing that you have to examine is something called as visual acuity. So visual acuity में what will you see? There is something called Snellen's chart. So literate people जिनको ABCD नहीं तो Tamil था तो whoever knows Tamil alphabets, there is something called Snellen chart. And yes, Snellen's chart ko it will be there like some few meters away from the patient, and he has to read the lines, the letters in the chart. So when he can read almost all the lines, that means the patient's visual acuity, that is the distance from which he can actually see things clearly, so that we can examine. And if the patient is illiterate, there is something called as Rosenbaum's chart or Jaeger's chart. So you use this if the patient is illiterate. Okay, so the next thing is color vision. So the second thing that you have to check in optic nerve is color vision. So in for checking color vision, you will actually look at the Ishihara chart. This is a chart where you can actually, there are like red and green are the most common thing colors that a colorblind person cannot listen to. So therefore, let me show you a picture of the Ishihara chart. So the Ishihara chart looks something like this. So you can see red and green color spots all over here. If the person is colorblind, he won't be able to tell which color is, he won't be able to tell the number here. So this is the Ishihara chart, which is for color. You can see this is the visual field test. So you can see the patient closing her right eye, and then here the examiner, he is bringing his fingers inside. So in this picture it is clear. So here the patient is closing her right eye and the examiner is also closing his left eye, and then he's going to bring this finger towards the eyes. So both of them should get to see the finger at the same time. So only then it is called the visual field is normal for the patient. So this is visual field test. Okay,